Alright, so now we're looking at the eyeball. We have the white, that's the sclera, and in the front as we come together and it's clear, we have the cornea. We're looking at muscles. We have on top a superior rectus muscle. On the outside, which is this side, because we have a lacrimal gland here, that's the crying gland, and that's always on the lateral side. We have the lateral rectus. Medially, we have the medial rectus, and guess what we have inferior? We have the inferior rectus right in here. On the lateral side, from the underneath, there is an inferior oblique coming in, and on the superior side, medially, we have the superior oblique that has a tendon. The trochlear tendon feeds into here. When we open it, we have the iris here that forms the pupil, and then we have the lens right in here. And then, as far as I'm concerned, we have the choroid ciliary body in this area, and we have the retina back in here in the posterior portion of the eyeball, and the optic nerve is just the stump coming out. When we look at the ear model, we have the outside ear, and that's the auricle on the outside here, and that feeds into an ear canal and terminates at the tympanic membrane or the eardrum. Then after that, we have the malleus, the incus, and the stapes. There's three small little bone ossicles, and they bring the vibrations to the oval window when we feed into what's the cochlea here, and that's where we have the organ of corti, that's the hearing, and then that terminates at the round window. But what we have here, we see the semicircular canals. We can look at the hemihead, and we have a few structures we want to look at. We have the nares as the opening in the nose. We have the nasal cavity right in here. And we can make up superior, middle, and inferior nasal concha. As we reach posterior, we have the nasopharynx in the back. Behind the tongue, the oral cavity, we have the oropharynx. And inferior, where we get into the larynx, we have what's known as the laryngopharynx. Here we have frontal sinuses, and in the sphenoid bone, we have sphenoid sinuses. The larynx has a tracheal cartilage in the front, pointing into an Adam's apple. And below that, we have a narrow cartilage in the front that widens in the back, and that's the cricoid cartilage. The cricoid cartilage has on top two arytenoid cartilages, and the arytenoid cartilages have vocal cords that feed from them anteriorly to the posterior part of the trachea, making vocal cords, helping us produce sound. This flappy thing up here is the epiglottis. This bone is the hyoid bone. As we swallow, the hyoid bone and the trachea reach up, covering the epiglottis over the opening, which is the glottis, and that way food and water or liquid do not go down into the trachea. Below, we have the trachea. These are tracheal rings. These are cartilaginous rings. We can also see the trachea on this model. As we take the lungs off, we have the blue rings, and that's the trachea. As they split, we get into the bronchi, primary bronchi. And then the bronchial tree feeds all the way down into the alveoli, where we have the gas exchange, the air sacs. The left lung has a heart pointing into it, so it has two lobes. That has an oblique fissure right in here that separates the two lobes, upper and middle, upper, superior, and inferior. The right lung has three lobes. We have a oblique fissure, but we also have a horizontal fissure, make us a superior, middle, and an inferior lobe. Let's go and look at the esophagus right here. Then we get into the stomach right in here. On top we have the fundus of the stomach. Then we have the body of the stomach. As it gets smaller, smaller on the inferior end or the distal end, we get into the pylorus. And the first section of the small intestine is right in here. That's the duodenum, the 12-finger gut. We have then the jejunum and the ileum. The only thing we can do is we can figure out which coloring it is here. between the two of them, but that's not going to be testable. But we can see the ileum because it feeds into the cecum of the large intestine and has the appendix hanging up. The vermiform appendix is coming right in here. Then we have the ascending colon, the transverse colon, and the descending colon feeding into the sigmoid colon down in here, into the rectum, and then into the anal canal and out through the anus. The large intestine has haustra. Those are little houses that help absorb the water. And we also have these muscle strands that lay on top of it. These are tinea coli. We can look here, we can look at the liver. When we look at the underside of the liver, we have the gallbladder here. And we have a right lobe and a left lobe. And in between them, we have the falciform ligament. The pancreas, the pancreas sits right here and has a head with a body and a tail that reaches the spleen over here, and it feeds pancreatic juice right into the duodenum. I do also have that situation on this model. That's the duodenum, the head of the pancreas, the body, and the tail of the pancreas touching the spleen.